Hello, everybody. My name is Amanda Johnson, and this is a presentation for Johnson's Jab business plan. So this is a business plan presentation for the new business model called Johnson's Jab. And this will be a mobile clinic that will help reach many people in need in the community to gain access to vaccine to help them remain healthy. And this mobile van will travel all over the county, creating opportunities for people of all ages to receive the necessary vaccines without having to travel to the doctor. The aim of this business is to open a mobile vaccination clinic that will reach the vulnerable and underserved population. This innovative approach to create a cost-effective, community-based solution for delivering vaccines to people who might have a challenging time, creating an opportunity for themselves. According to the most recent report from Centers of Disease Control and Prevention on source and accessibility of healthcare in the United States, about 17% of patients do not have a regular place to access healthcare services. The inconvenience and lack of access of vaccines may contribute to these statistics, and it is our goal of this mobile vaccination van to address these as part of their strategic goal. Their interactions create community partnerships which help tackle environmental health issues that currently plague the population. So the mission of our business is simply stated here: to reach the underserved and hard to access people in the community by delivering necessary vaccines to promote health and safety in our community. Our vision: Johnson's Jabs, a mobile clinic that focuses on reaching every member of the community by working collaboratively with community members to increase access to vaccination opportunities, thus creating a healthier population. The nature of our business is a mobile clinic that offers vaccines to hard to access underserved areas in the community, creating opportunities for people to get vaccines without hassle and expensive office visits. And our mobile business will travel all over the county for many different events. So here we have our services and products. Our services are administering vaccines and creating these special events in the county where we can vaccinate many people. Our products are vaccines for all ages. We can offer COVID-19 vaccines as well as seasonal influenza vaccines. Our stakeholders are our investors, our creditors, and our employees, and our customers are community members in our county. So our competitive environment, the major competitors will be surrounding physicians' offices who are able to get their appointments on time. Since our county is in a rural area, there's a primary care shortage, and this does not pose much of a threat to the clinic's purpose. One of the social environmental factors are people themselves who are unwilling to vaccinate. Patients in the rural county have a natural hesitancy to get vaccines. There's much discussion around a competitive environment in this business. The truth is that competition in business is meaningful and necessary because it determines different activities that the business might engage in and increase its performance. Competition determines the appropriateness of a firm's activities that can contribute to its performance, such as innovations, a cohesive and integrated culture, or good implementation. Good strategy for an organization is to be in an industry. The goal is financially is to be able to offer services and have cost of these services surpass the cost it takes to create it, while still offering competitive prices to our customers. Business gains from healthy competition as they are nudged to not only outperform the competition, but to improve on what they already have and also diversify to grow and share risks involved. So in this slide, we're going to talk about ethical and regulations. So the discussion surrounding regulations and ethical concerns regarding mobile clinics is growing rapidly. When looking at local and state regulations, they are very much the same. State and local agencies work together to coordinate health efforts for the population of people needing services. This mobile clinic must have a system will integrate their technology with other healthcare systems to allow for a seamless continuation of care and record sharing. Efforts made on a federal level have a lot more to do with payment models and making policies. We believe the specific government funding programs should be implemented to provide needed funding that will allow for both growth and expansion of a number of mobile clinic programs. Federal funding should be put into increasing technology capabilities with mobile clinic programs. This advanced technology will allow collaboration with other stakeholders who participate in the healthcare system. So ethical questions do arise when you talk about a mobile clinic business. One concern is that these clinics could be making patients not see their primary provider. This could raise the question of whether this is the right way to care for patients. This also poses the question of, are these mobile clinics really meeting the healthcare needs of patients appropriately, or is it deterring patients from visiting their primary care providers on a regular basis? So market strategies will be implemented as part of the business model for this mobile clinic. Traditional marketing methods such as magazines and newspapers were a way of the past. As per data published by Social Media Examiner, approximately 92% of marketers who participated in the study agreed that social media efforts have generated more exposure to their business, and they have found it useful. So the key point to this would be to create a proper content to engage the viewer no matter what the product is. The proper content will make an impact on the person and stick with them. This is the right content to engage the viewer. So social media is also very cost effective. It has also been estimated that an active member spends more than 50 minutes a day scrolling through various social media networks. Social media allows for a business to run an ad. Not only millions of people get to see this, but instantly through sharing on social media, this allows for millions of views overnight. It's easy to tweak and adjust social media content because it only takes a few clicks on a computer program, and you can add or reconfigure your ad, and it rolls out to millions of people again fast. The traditional way of advertising would not allow for this. Many products would have to be thrown away and started over. So the cost of advertising for this mobile clinic is minimal through social media, but the impact is impressive. So here we're looking at our HR plan. So the first year of business will include minimal staff. Starting slow is the best way to ensure business can support the services and the staff in the years to come. Will hopefully include expansion. The main person in charge will be the owner, also known as the Chief Executive Officer or the CEO. This person oversees everything. All the financial decisions are made by this person. The next tier of people are the ones who keep operations running and make operational decisions. The manager will oversee daily operations and an appropriate part of the business. The marketing manager will try to increase services and outreach opportunities. Human resources will oversee the recruitment and retention for the mobile clinics. They will also oversee the hiring and take part in some of the regulatory requirements, since the recruitment and retention for this business is currently very small. The last layer of employees are the ones who participate in the patient care. The physician will be involved in overseeing the vaccinations that are being offered, administered, and assuring that the timing is correct according to the CDC guidelines. The nurses manage or medical assistants will help patient intake and giving the vaccines. Clerical staff will manage scheduling and insurance taking and billing. They will schedule appointments and take care of all the necessary paperwork. Environmental services are particularly important because they are in charge of making sure all the cleaning is in accordance with guidelines for the Centers of Disease Control. It is the first year, and if it proves to be successful and profitable, the CEO and managers will investigate expanding services and staff. There are necessary components to a financial forecast that should be considered, realizing that as time goes on, the business might change. The first this to do is identify the revenue or income and the finances needed to run a mobile clinic. Research the supply cost and inventory needed, as well as projecting the revenue necessary to sustain the mobile clinic. The income is simple in this case. It is considered the charges for a visit and the vaccinations that are given. This mobile clinic will work with the state to receive vaccinations so that that expense is not included. Equipment and supply costs come from two sources. Vaccines come from the CDC's fee schedule, while medical equipment and supplies come from the manufacturer's suggested retail price of medical distribution companies. Marketing, vehicle, gasoline, insurance, staff salaries, and office expenses are based on an average predicted estimate based on what cost would be in a clinical setting. The per visit designation comes from the thought that the mobile clinic will be able to service 100 patients in a week in distinct locations. Grants will be the primary income used for the startup of this project. Seeking government funds to address a health need is widely approved source of funding for this type of business. Donations and grants should also be sought after, but most of all, current mobile Unity should aim to increase its patient population. Increased marketing efforts should be included to increase communication and outreach. There's a lot of funding in healthcare currently for this type of business venture due to COVID-19 pandemic and the need for social distancing. When purchasing a vehicle, considerations must be made surrounding the discussion of privacy and the different areas that might need to be traveled to. This will affect costs. Although a specialized vehicle might not be necessary, the clinical area must provide adequate patient privacy and must be appropriately outfitted for the local climate. Vaccine hesitancy is definitely a risk. Many people don't want to get vaccines because they don't want to put things in their body that they don't trust, or because the cost of vaccines might scare them off. A 2020 questionnaire distributed to 3,865 individuals showed economic hardship to be associated with vaccine refusal. Additionally, a study of 10,871 participants showed vaccine hesitancy to be fivefold and twofold higher among Black and Hispanic populations, respectively, compared to their white counterparts. Environmental contamination control is another risk. The mobile unit must make sure that the environmental services employees are up to date and on proper decontamination requirements and regulations. Another risk is the unknown weather terrain that this mobile clinic will have to travel on certain times of the year. When purchasing a vehicle, the team must make sure to consider all weather patterns and different road accesses. Even taking into consideration all of these risks, the mobile clinic vaccination van will be able to provide adequate and quick services to many people all over the county that are cost-effective and convenient. So in conclusion of our display here, mobile clinics help in the delivery of high-quality healthcare to at-risk populations all over the county. A growing body of research supports that mobile clinics are a valuable, cost-effective model to healthcare delivery for a variety of clinical applications, including vaccination. The main strength of a clinic, such as a mobile van, is that it can provide healthcare services to those that have no access due to social or financial reasons. As shown by